we'll start by, if you're watching this on YouTube, of course, subscribe, like, and comment on this great program. So I'm going to start by introducing these individuals. Hello, Nicole. Nicole Smith
Hello.
Holt, I believe, right?
Nicole Smith Holt. Yep.
Oh, let's mute you here. Okay, let's try that again. Try it again.
Nicole Smith Holt.
There you go. All right, great. Thanks so much. Tell us a little bit about yourself.
So I am a mom. I live in Richfield, Minnesota, and I am an Insulin for All advocate.
Okay, fantastic. Yeah, and you've done some work there, and we'll get into that. We'll get into exactly that story. We're very happy to hear it. Thank you for joining us. Okay.
Thank you.
Next, we have Mike / our good friend Disability Justice, which you all recognize. I literally just learned his name like 2 days ago. I've only called him just Justice, but thank you. You're very familiar to my channel. How are you doing today, Mike?
I'm doing good. I just found out I got accepted on the city code task force from my city, so trying to redo the city code and everything. Gonna make it better for disabled people.
Okay. Oh, all right. Oh, fantastic. I love it. I love this actual efforts, to work local politics, right? We have a few people here who are actually doing that. There's so much change that can be done on the local level, local and state level. But our eyes are usually laser focused on the federal. So I love that we have individuals who are doing that hard and very valuable work. Again, pushing the ball, taking opportunities wherever we can. Thanks so much for being here. Okay. Next, we have our great friend Empress. Thank you, friend. Thanks for coming through. Empress was one of the first people I thought of when we were going to put this together, and I was so happy because the Empress is an organizer themselves and has been talking about what's actually doing practice.
I actually got my start being sort of involved in political activism through disability justice because I myself am physically and developmentally disabled. So it's a seriously close to my heart topic. I have some awesome not awesome, but some very powerful stories to share. So awesome in the sense of awe-inspiring in the very literal sense of the word. So yeah, I'm excited. This is not something I usually get to do on Twitch. So usually this is kind of offline.
Okay, thanks so much. All right. Next, Anastasia. Won't bother trying to pronounce the second thing. Anastasia, thank you so much for joining us. Another new person to the community. Anastasia, please tell us a little bit about yourself.
Sure. My name is Anastasia. I did not choose my last name. I know it's 12 letters. Thank you for bearing with me. I worked as Elizabeth Warren's social media director, and before that spent a couple years in political consulting at Trilogy Interactive, and now I'm back there leading the social media department as a senior director, working on all levels of government, working on campaigns with nonprofits, with organizations, and very much want to echo what was said about the importance of local government. I think it's very important for us to also focus on, initiate change at the federal level, but I think there's so much we can also do locally. So I want to echo that as well. Yeah, excited to be here.
Thanks so much. All right. Last but absolutely not least, our very, very, very good friend, JohnnyScarlett. My channel knows exactly who this person is. And they were literally the first person to volunteer, right? I announced this on Tuesday, and they jumped in immediately. Like, I want to be a part of this. So I was so happy, ecstatic to have them be here. Johnny, tell the world a little bit about yourself.
Hi, thank you so much, Prime, and it's so good to meet all of you. My name is JohnnyScarlett. I stream here on Twitch, and I am greatly affected by my access to healthcare and medication, and my ability to live my life in a normal way is very greatly affected by this. So I wanted to come on and I wanted to tell people sort of how that has come to be in my life. I'm excited to support this very important cause. Thank you so much for having me.
Okay, all right. So once again, what we're going to do here is we're going to have these kind individuals share their stories, right? But if you want to be involved, Vin is live there. Beat me to it! ! M for A in chat. to be a part of this movement, right? So join the Discord server, join the M4A Discord server run by Be a Hero, and get plugged into the movement. We would love to have you, all right? I'm going to be pushing that constantly, so it's going to annoy you, so just do it. All right, we'll start with Nicole. Nicole, please tell us your story.
So my story actually starts in 2015. In 2015, my then 24-year-old son, Alec, became ill. We didn't know what was going on. We thought maybe he had the flu, some sort of virus. It was kicking his butt. I happened to be at work one day and he called and he said, "You know what, Mom?" He's like, "I'm getting worse. I feel like I'm dying. I don't know what's wrong with me. I think I'm going to go to the doctor." And I was like, "Okay, call and schedule an appointment. If you can't get in, then maybe you should go to urgent care or something." And he called me a couple hours later. And he said, "Well, they figured out what's wrong." And he said, "They diagnosed me as a type 1 diabetic." Now, Alec was just turning 24. And I thought, well, that can't be right because type 1 diabetes is juvenile diabetes and you're not a juvenile. And he said, "No." He said, "This is what they said. I'm a type 1 diabetic." So I immediately got on my computer and I started doing some research. And turns out that a majority of all type 1 diabetics are actually diagnosed in their teens or early adulthood. So it's not that uncommon. It's just something that we just don't hear about. When you think of juvenile diabetes or type 1 diabetes, you think of children. He was just turning 24, so he was still on my insurance. I work for the state of Minnesota, so I have, what's considered really great insurance. But yet he was still out of pocket spending between $200 and $300 a month just for his insulin and his diabetic supplies. It's an extremely expensive diagnosis, and it's a chronic illness that never goes away. There's no cure for it. You can only treat it with daily and multiple injections of insulin per day. And it gets even more expensive if you are eligible to get an insulin pump and a continuous glucose monitor. Those are, extremely expensive and sometimes really difficult for insurance to cover. But anyways, Alec, at that time he was working at a family restaurant. He was a server and bartender, and he was able to make, decent money, and he was able to afford his out-of-pocket expenses. Shortly after that, it was about 2016, he received a promotion, and they promoted him to restaurant manager with a salary of about $40,000 a year before taxes. He was pretty excited about that and decided that, I'm going to financially be independent at this point. I'm going to get an apartment. I'm going to move out. And so around that time, he started looking for an apartment, and he moved out of the house. He was 25 years old, and he was doing pretty well. And again, he was still on my insurance, so he still had that protection. Early 2016 or 2017, as he was approaching his 26th birthday, I was like, "Oh, we got to figure out what's going to happen when you age off of my insurance." His job didn't come with any benefits. It didn't provide insurance for him. So I did a lot of research, and I searched through the marketplace, and I kind of created fake accounts to get an idea of what he was going to be looking at per month for insurance. Being a single guy and making about $40,000 a year, the insurance through the marketplace was going to be $450 a month with a deductible of $7,600. That is absolutely ridiculous. So on top of rent and insurance, car insurance and all your other bills, he would have been facing that expense. So my son decided that he was going to forego buying that insurance because it was, he would have been able to handle the premium, that $450 a month. It would have been a struggle, but he would have been able to afford it. It was that deductible of $7,600. With a chronic illness, he would have been paying out of pocket for the first 6 to 7 months for everything that he needed to stay alive per month. So he decided he was going to take that $450 and just apply it to whatever his bill was going to be when he went to the pharmacy. And on May 20th of 2017, he turned 26. Turning 26 is usually not a big deal, but it was a horrific day in my life because at that point I knew that his life was gonna change quickly. June 1st was the first day that he was officially uninsured. June 22nd, he went to the pharmacy for the first time to pick up his insulin, and they told him it was $1,300. And Alec only had $1,000 in his bank account, and he didn't make a phone call to me. He didn't ask me for money. He didn't ask for help. He did what about 1 in 4 type 1 diabetics have done in their life, and he went home and he started rationing his insulin. He started eating a keto diet and reduced the amount of insulin that he needed, hoping that it can stretch to a payday. On June 27th, just 5 days after he left that pharmacy, I got a phone call that my son's body was found on his bedroom floor in his apartment. He had been dead for about 18 hours before anybody had found him. Insulin is not a product that can be rationed. Insulin over the past 20 years has increased in price over 1,200%. It costs roughly $5 to manufacture a vial of insulin, and it is sold at every pharmacy in the United States for over $300 a vial. And type 1 diabetics typically need more than 1 vial per month. And I've done this, I've gone to Canada and I've bought the same vial of insulin that Alec could not buy here at the local Walgreens. I walked into a pharmacy in Canada without a prescription, without a need for insulin, because I'm not a type 1 diabetic, and paid $28 for that vial of insulin. But yet it's sold here for over $300. It's sold everywhere in the world for 1/10 the price of what we pay here. What happens in the US with our healthcare system, it's criminal. It is absolutely criminal. It is a for-profit system. I completely blame the death of my son on our government, our healthcare system, and the greedy pharmaceutical companies. And so after Alec's death, I said, I took some time to grieve, and then I started sharing his story. And the more I shared, the more I heard back from people all over the world that that's something that only happens here in the US. And it is very common in the US. And it has resulted in a lot of deaths. So I decided that I was going to continue to stand up and share Alec's story, and I was going to somehow change this system. What I figured out is it's pretty hard to make changes at the federal level. So I started at the state level. I mean, I have allies in Washington, D.C. I've worked with Amy Klobuchar and Tina Smith, and we're really trying to make some federal changes. But at the state level, it seems to be a little bit easier. Here in Minnesota, we created and we passed the Alex Smith Emergency Insulin Act, and that provides a very low cost. I'm sorry, you guys.
That's
Getting over a nasty cold.
no problem. Yeah, please take your time.
What we've been able to do is the first in the country. We've created a safety net program. We have an emergency insulin bill, and we have a long-term insulin program as well.
If you need to take a
Sorry.
moment, it's fine.
No, I'm okay now, I think.
Okay, take your time.
So we've been working with other states to create this bill as well. Colorado is on the verge of passing their bill. Maine is working on passing their bill. Connecticut and Illinois are working on it as well, and Montana. So I think, you know, if we did not have our current healthcare system, if we had something like the Medicare For All program, I would still have my son. What I'm hearing is 1 in 8 people leave the pharmacy without their prescription medication because they can't afford it. There's something seriously wrong with our system. And when people reach out to me from all parts of the world, even countries that you would consider, third world countries, they don't have these issues, there's a problem in the United States. I mean, the programs work, the socialized medicine works in every other country that has implemented it. And I really think that, we need to do something here. We need to start from the bottom up. We need to start thinking about healthcare as healthcare instead of, a for-profit industry. Get rid of the PBMs, put restrictions on pharmaceutical companies. These insurance companies, we pay thousands of dollars a month for insurance, and then to turn around and get denied procedures or denied, preferred medications. There's something really wrong, and we really need to think about, putting the lives of the citizens, the lives of people before the profit.
Definitely agree. Thank you so much for that. It was a very, very powerful story. Thank you.
Thank you.
Yeah, so I just wanted to examine that for a bit. One thing we'll start with, sorry for your loss of your son.
Thank you.
And we've seen so many people go through exactly this, right? This rationing you're talking about, right? There's life-saving medication, something that is a basic medication, right? So it's not something exotic, something cutting edge. It's insulin, right?
Right.
And as you stated, very cheap to produce. We've actually talked about this on this channel previously. Talked about what it takes, that pharmaceutical industry, right, will jack up the prices, and the government cannot negotiate with them on these on individual, not only just drugs, right, but each medical item, right? So bandages, right? We've heard the stories of a $15 bandage. Right? This has happened, and this is considered normal. This is just how we operate here, and it's fine if you have excellent private insurance, right? If you have a great job, that does that for you, then these things are invisible to you until, for instance, you're out of network and you have to pay out of pocket, right? Until you lose that job and that bill comes to you for the first time. And so the system you were under, in which your son could stay on your health care plan until he was 26, right? That was from Obamacare, if I'm remembering correctly, right? Yeah. Yes.
Correct. Yes.
Yes. That was a change, and a positive change, certainly, but obviously insufficient. So her son gets off her insurance program, right? And has to deal with the market, right? The tender mercies of the market himself. Price unbelievably high. I mean, like that's like rent in New York, but like multiple times people's rents in other places. More than this person has in their bank account. So making the tough choices, like, okay, well, I'll make this work somehow. I'll sacrifice in one area and maybe smaller dosages or whatever it is to stretch this out. It doesn't work because the body doesn't work that way. The body isn't economical in such a fashion. But what I love about your story, right, the part that is amazing, is the organizing that you've done on the ground. That you saw that this was an issue, realizing that on the federal level, there's not much that could be done. So you worked at home on the state level. This is what Be a Hero is about, taking those victories anywhere you can, right? And you actually went out there and made change. When you did that, when you made that effort, like, how responsive were your state representatives?
It's amazing. I've worked with an amazing group of state representatives and senators. Minnesota is one of the, I think, only split legislatures in the U.S. right now, and realistically, we should not have passed such a huge bill in such a short amount of time here in Minnesota. But they saw us show up consistently for 2 sessions and share our stories and, basically, show them the proof that this is the type of thing that is needed. It was great to see that we had such a huge support and people willing to go to bat and fight for this, because type 1 diabetes, insulin, those type of things, it's a lot more common than people think. There's, gosh, I don't even remember the number off the top of my head right now of people in Minnesota alone that have type 1 diabetes. But I tell you, it's over 7 million in the US. That's a lot of people. This issue affects a great number of people.
Yeah, agreed. We'll come back to this later on. We have another individual. I want to get to them quickly. So we'll go to Anastasia next. Anastasia, thank you so much again for joining us. Please tell us your story.
Absolutely. The first thing is, Nicole, I hear you so much on the points about insurance, points about rationing. I relate to that a lot. So my story begins on a Monday, two summers ago. I dropped ice cream on my kitchen floor and I struggled for hours to clean it up. By Tuesday, it felt like things were constantly slipping out of my hands, and there were so many different things I was blaming. I was on the West Coast working East Coast hours, and my keyboard was broken, sure. And then just by Wednesday, typing became difficult, and by Thursday, I woke up feeling like glass was exploding in my head. And I remember vividly thinking, I can't live like this. So I went to urgent care. And they did a scan. Some of my symptoms resembled stroke. The good news, that CT scan, was that I wasn't having a stroke. the bad news was that I had glioblastoma, the most aggressive form of brain cancer, the one that killed Ted Kennedy and the one that killed Beau Biden. And I still remember asking the person who did the scan, does insurance cover this? How much is this going to cost? And he told me, I don't know. Insurance is evil. And every single day I've lived that out. I know that folks have spoken about how there's good insurance and you won't feel these costs. And in theory, I mean, I have a premium plan under the Affordable Care Act, and I ask about insurance every single time I go to providers. But just this week, I was asking a provider initially before I had the meeting that if I was covered, and they said yes. And so I went, hadn't had the appointment, and then after I get billed for the full cost. I asked them about my insurance, and now they're saying that I'm on the hook for it or I'll be sent to collections. And I was also lectured about how it's my personal responsibility to go to my insurance and ask them if they cover a specific provider, not trust a provider to communicate that accurately to me. And there's just so much. It's a nightmare to go through this process, even if you have the platinum plan through health insurance. And on top of that, right now, you can probably see that I'm having a little bit of trouble breathing, and I might look bored too. I'm nauseous from chemotherapy, and sometimes it's hard to, look at a video on a camera. And it's so frustrating to have to go through this process. I've gone through surgery, through chemotherapy, radiation, so many different things, and it's frustrating that at this most vulnerable moment of your life, you, number one, have to maintain a full-time job to have that health insurance, right? And then on top of that, you also have to manage all of the appointments and all of the financial obligations and all of the many, many things that go into having this condition. It's frustrating and it's maddening, and it's not a workable system. And there's so many different ways that I think that it's important to say that Medicare for All would benefit people who are insured. In the simplest example, Medicare for All, I constantly have to share new medical records, and it's like starting from scratch with every single new provider from square zero. And it's always a surprise of having to check that, I'm covered by this one, I'm covered by the insurance with this one provider. Every single step is always a new process, and it's a nightmare, and I don't think it benefits anyone. And it's a system designed to maximize profits, and that's exactly what it does. It does a great job at that. I'm sure there's many CEOs thoroughly enjoying their yachts. You know what it doesn't do? It's not designed to maximize patient length of life or quality of life. And I live that out every single day. Insurance is designed to maximize profits. Our healthcare system is designed to maximize profits. It's evil, and I live that out every single day.
Thank you for that. Yeah, so this is a story that I've heard often in terms of dealing with the insurance, right? So I worked in the hospital. Previously, and worked in a department that had to, the thing it did on the side is dealing with insurance denials. And each one of those denials that came through, right, had to be fought, right? So we had to have infrastructure just to fight these denials, right? Remember, this is care from people with insurance, right? We're talking about people with insurance, dealing with that while they were sick, right? And so we would go back and forth with these companies, right, to get them to actually pay for what was paid for. And it was the amount of effort putting into this, right? And it was very important to the hospital, because this is how the hospital made its money, right? So the amount of effort into the and time putting into this was massive. But I always was thinking about the individuals on the other end, individuals like you, Anastasia, right, dealing with these diseases and fighting for their lives, but also having to fight to get themselves covered, right? And then those are the ones with insurance, and the ones without, we know GoFundMe is the answer today, right?
And the thing is, even if you're covered, I'm like the textbook example. I was 25 when I was diagnosed with brain cancer. You'd think insurance is designed for that catastrophic event. You're covered, you pay for it, and it's not. It falls through all the time. And I'm so sick of also, it's up. I think you also kind of spoke to this, where it's up to that individual provider that you're speaking to, the individual billing department, to not lie to you. And I'm also so sick of also being, spoken to. For instance, I remember trying to explain to the ambulance folks at one of the hospitals I was at that I didn't need an ambulance to transfer, but I know that they will bill me out of pocket. They won't go to my insurance first. And I tried to explain this to them. And I was spoken to as though I'm a child, like, oh, don't worry. Of course they'll bill your insurance. It'll just be fine. It was not fine. It was not fine. They billed me. And then, for instance, even this week, I spoke to that provider, and they called me, and that they would send me to collections. And then I got another call saying that, oh no, sorry, that was a mistake. We'll take care of it. And then I got a call after that. So this is call number 3, saying that last call was a mistake. I'm still on the hook. You have 90 days since your day of service to pay, or you're going to collections. So it's up to individuals who in some cases just make mistakes, or in some cases just don't care. And there's so many different cases of it's frustrating, and it shouldn't be this way. And I think in the insurance for-profit system falls through constantly. And I interrupted you. I'm so sorry. I think I want to make sure you have time to finish your story.
Oh, no. This is your story, not mine. I'm just trying to expound on it. But yeah, I was just... the struggle, right? So that with the ambulance, right? So understanding that, as you did, that I am covered, right? I have insurance, but different services might not be covered. They might go to me, be billed to me personally, and there's something I believe it's called surprise billing, but I have known.
Oh, I get that a lot. Oh, yeah. And in theory, it should have been outlawed this year, but in practice, I tried calling my hospital to ask how much an MRI would cost with this specific type of insurance. Should I get the gold or should I get the premium, depending on how much these would cost? And they couldn't tell me how much it would cost after insurance. They just would not tell me. What I could do is get the service cleared by my doctor, get the service, and then get the bill. So thank you.
Yeah.
Great.
Yeah. Within the same hospital, so you have a hospital that's in network, and then you'll be a doctor who is somehow out of network comes.
No.
Sorry.
Oh, that could happen. I'm sorry, I interrupted.
Yeah.
But what I'm asking about is I want to know how much an MRI would cost. In theory, it could cost like a couple $100, $1,000. I want to understand how much it's going to cost after insurance, and they could not give me a quote. What they need me to do is get the doctor to submit the order for it, and then insurance to authorize it, and then for me to get the service, and then get the bill, and then I could find out. And just imagine it. What other product in the world do you have to get the product to find out how much it costs? Even in the most textbook example, in this perfect landscape of perfect competition that some insurance advocates and for-profit health marketplace folks advocate for, it doesn't work that way. And even with these various regulations that are passed to get like a little bit of a band-aid on the current system, that's not what's experienced by folks. We need fundamental change.
Yeah, I was just giving another example of that surprise billing, but no, exactly that, where you just don't know the price of the product. Amazing. Thank you for sharing that. That was a powerful story. Thank you so much. Do you need to step away? I know you weren't feeling great.
Yeah, I'm going to step away, but it's really lovely to see you, and I appreciate all of you.
Yeah, no problem. Thank you so much. Have a good one. Okay. Thanks. All right. I thought that was really great. We have more stories for you. And remember, so I'll just take a moment in case you're just joining us. We are going to continue this conversation after we've heard all these amazing stories. We're going to continue this conversation and the Be a Hero campaign's Medicare For All server, !M4A in chat, to be a part of that. Jump on in. So what we're trying to do is plug you all into the broader movement. You're looking to make a change? Well, jump into the M4A Discord server, and they can help direct our efforts to do this. So we're doing an all hands on deck approach, right? So looking for victories anywhere we can, right? Just like our friend Nicole here did, making changes within her state legislator, right? Moving the ball forward so that people can get the help that they need. So not just federal Medicare for All, but also state-led single payer and state public options, or lowering the eligibility age of Medicare to 55, right, which is a Bernie Sanders effort right now. Like anything that we can to move the ball along, that's what we're trying to do at this moment. So we're going to listen to more individuals, but after this, we're going to go to the M4A Discord, and we want to hear from you. We want to hear from individuals who have had their own stories. We'd love to have you. We'll be using the stage function, so it'll be audio only. So you don't even have to be on camera. Just want to hear from you. All right. We'll start with our next friend, Mike. Mike, thank you so much for being here. You have been a big into the activism yourself. You introduced me to Nicole, which is so kind of you. Yeah. So Mike, tell us about your story.
Hi, I'm Mike O'Brien. I'm from Minnesota myself, small town, kind of, well, relative, I guess, compared to the larger states. Small city called Burnsville. I just kind of, I mentioned earlier, I just got on the city task force, and my main goal with that was kind of disability advocacy. When we're thinking about how the city is planned and ran and everything, and like how the city code looks like, if it's simplified more for disabled people so they can understand it too. I'm the chair of the Dfl Disability Caucus, which is the Disability Caucus in Minnesota for the Democrat Party. I've worked on a lot of campaigns locally here. I'm not as big of a superstar as Nicole. She's like a local hero for me. I mean, like, just so awesome what she's done. Like, I don't know. I knew when Prime came to me, I was just like, if you're asking me, you got to actually have somebody like legit on here. Like, you got to have Nicole. Like, she's done some real stuff. So, me, I was born with half my heart, called hypoplasic left heart syndrome, and it's basically like either when they say half, it's not like cut down the middle, just half of it's gone, more of just like it's underdeveloped. It's considered a heart defect, and heart defects are the #1 birth defects in the country. I think like 23%, 20-some percent of defects, birth defects, are heart defects. And that's just one of the ones that I have. So it also made it so my left lung basically didn't function at all because there was no artery going to it, because that side just wasn't fulfilled. But yeah, I also only have a single ventricle in my heart because of it. So ever since birth, I've had so many surgeries and everything like that, and they're all like 50-50 at the time because this was in the early 80s. And now that I'm older, I survived all those things, but like, most people that I don't think understand that when you have like a kid that's like has all these birth defects or something like that, like it really puts a lot of stress on the family because it's just so costly. There's so much time into it and there's so much cost into it. Like, sometimes you just need to like go to a different state because hey, they don't do the surgery for my kid over here. So I got to move all the way. What happened to me is we moved all the way to California for a little bit. I was born out here, but after I had like my first 5 surgeries, they're like, that's all we can do because there's no hospital that does this one new one. And they recommended a couple hospitals after talking to people that do them. So we decided to go out to California, to go to UCSF to get one of the final surgeries at the time that I would have had. And it was probably the most high risk one It's called a Fontan surgery. Nowadays they do them all the time, but back then it was relatively new. With my diagnosis, only 1% of the people ended up surviving it within the first year. And then, so yeah, my family's life was just, my mom just basically was with me, all the time in the hospital. And then all she just thought about was like insurance things, and then we just had to sign up for trials because sometimes the insurance won't pay for something. So you got to sign up for a trial for some other wacky thing, like a drug or whatever to see if it works. I mean, I've probably been in 7 clinical trials myself just because I can't afford the medication. There's one for a drug that I recently was trialed on for 2 years. I don't know if I ended up getting the, real drug or not, but you risk it because you're like, well, I can't afford it anyways, so I might as well sign up for the clinical trial for this thing, for the study that they're doing. Because maybe I'll get it, maybe I won't get it, but if I don't do it, I'm definitely not going to get it. A lot of times you end up having to like beg these insurance companies to give you like what they call like charity care. Sometimes they'll give you like a coupon code or something like that for certain drugs that they have that they know are just not affordable. Even if you have insurance, ever since I was 18, I've had Medicare, and ever since, well, it's been for like the past 4 years, I finally got Medicaid, but I was never low enough income to get Medicaid. But then I was just, I wasn't, I ended up just going into more debt and everything like that, even though I was over the income limit. My Medicare only covers like 80% of the stuff. The pharmaceutical stuff doesn't cover a lot of stuff. So sometimes you have to have like a supplemental insurance. I couldn't really afford it. So you just kind of go without taking some of these medications sometimes. And just hoping that you don't need it. It's just like, okay. And so sometimes I would sign up for like those charity programs, try those out just to get some of the medications. But sometimes they only last like a year. Like I was on one where the program, the funding for it only lasted for a year. And then they're like, yeah, it's out. And I was like, how much is it now if I just pay for it myself? Oh, $16,000 a month. And I was like, oh, okay, well, I guess not. I said, well, that was fun while it lasted. And it sucks because that was like a drug that actually worked out really well for me. No, I can't get any insurance company to like cover it. The thing is if they do, they won't cover something else that I need just as much. So I'm just like, well, like a wash, I might as well just stay with what I'm having now. Yeah, and now I just had to basically go into poverty. I had to stop working in order to get better insurance. It's so stupid. Like I actually had to kind of just stop doing what I wanted to do in life, which was I just like being part of like the food industry and stuff like that, and working. I was planning on having my own line at the farmers market selling food products, and I just had to stop doing that because I made money that was just over a little bit too much, and then the amount that I was paying in the end with medications just totally was a big deficit in comparison to the money that I was making. So I was like, okay, I just have no economic freedom now. I have to basically stay in poverty just to get Medicaid on top of my Medicare. And now there's a insurance company in Minnesota called UCare, so they combine them both together. And it's pretty decent, but I mean, that's just because I live in Minnesota. I mean, if I didn't live in Minnesota, I wouldn't have these. I've lived in other states. You don't get shit in other states. Like Nicole said, like there is one good thing about Minnesota. It's like our healthcare insurance and everything like that is fairly good. I mean, not all the time. Like obviously for her and her son, it really sucked. But there's times where I'm glad at least I live in Minnesota, because I mean, even in California, I was screwed. And like some of the counties, they're just like, yeah, you just don't qualify for Medicaid. And I was way, way, way like poor. So a couple of years back, I was trying to get this was my first attempt at getting a heart transplant. I was going through the thing. Basically, I don't know if anybody's ever tried getting like organ transplants, but you basically have to make like a huge case for yourself. There's a huge evaluation. This was at Stanford. I was doing this, and I talked to some doctors and everything like that weren't part of the system. That kind of gave me like some guidance on like what it's going to be like, what I'm going to get like counted for, like what I should, what all have to account for that they're going to look into, that they're not going to tell me, that they're going to like think about. So he was just like, basically, if you're poor, you're probably less likely to get it. I was like, oh, sweet. And he says, if your insurance sucks, they're not going to give it to you, because transplants cost like $1 million something, because they have to account for you for at least that first year after the transplant, not only the surgery, but your like life is on their marks, like on them for the next year.
Mhm.
Like if you die or anything like tragic happens to you for the next year, it looks really bad on their record. So they're like, nope, we want you in tip-top shape. We want to make sure the insurance will cover everything. You're going to be fine. You're going to be able to get every treatment you need and everything like that. And I was like, holy shit. I was just like, so if I'm poor, I'm screwed. Like, I'm never going to get this transplant. Sorry for swearing.
No, it's fine.
But it was just like, it was mind-boggling to me that would be like one of the reasons why I wouldn't get a heart, is because I was poor. And they account for that more than anything else. Like it seemed like they wouldn't even see me unless they knew my insurance was going to cover everything. I was like, oh, you won't even start the eval then. Go with it. They're like, nope. Unless we know that the insurance will cover everything, we're not even bothered. So I finally, like, I was able to get them. I applied for they have these grants at some of these bigger hospitals. They also call it charity care there too. Sometimes they have different names. You have to like write this whole thing about yourself. You have to like, basically tell them your life story, why you need this grant, why it is you're poor, how if you get this money, you'll be able to like elevate yourself and stuff like that. Because the costs of all these things won't, you'll be able to have more money for more things, and like if you want to start a business or something like that. So I wrote this assuming that I was never going to get it or anything like that, and I ended up getting it. I ended up getting a lifetime thing, a grant from my entire life through Stanford, by the luck of the like draw. It felt like I mean there was, I've talked to other people who applied for it that didn't get it. So it's just it's so silly that I have to like hope and beg that I'm going to be one of the people that gets selected for this thing, for this like grant. And once I got the grant, which, if I didn't get the grant, they wouldn't have even done the evaluation on me. They wouldn't even thought about it. It wasn't even like a thought in their head. And I had Medicare. Medicare pays for 80% of it. But that 20% is enough where they're like, nope, not enough. Because it's going to cost at least $1 million. And they're like, you can't pay for the next 20%. And I was like, well, yeah, obviously I can't. What, are you crazy? No. And the fact that these are the things that like, just if you don't have like the best insurance, you don't have like everything, you don't have like, if you just don't want to be like, if you want to elevate yourself or anything like that, it feels like you can't sometimes, because we don't have a healthcare system that makes it so I don't have to be in poverty in order to get like full coverage on everything. Because that Medicare, Medicaid situation is the only thing that's keeping me going. But now I just have to be poor. I can't take, like, if I ever want to run for office, I can't. I literally can't run for like city council or anything like that because I'll lose my I'll just get too much money and then I'll lose that insurance, and state insurance um isn't good enough for me. Like it doesn't cover everything. Like that alone, just me getting that extra income would actually make me lose money. Like I would just like to see a system where it's not based on income, at least. Maybe you can have it like like if you want additional stuff, but there should be like a basic, line where everybody just gets it that's a citizen at birth or whatever. And that way if you just need some of the basic necessities and stuff like that, if you just need to see a doctor, you can do that. But like if I need if you can combine my Medicare with that or something like that, or it then makes it easier for Medicaid to qualify for that, where it's you don't have to just basically be the poorest of the poor. That would be great. But I mean, and right now with all the insurances I do have, I just got diagnosed. Well, I mean they re-diagnosed an esophageal disease that I have called eosinophilic esophagitis. It's just like it scars, eating certain foods scars your throat and it closes it up. Not in the same way as like anaphylaxis, but it just causes like ringing and scarring of your throat, so it gets more narrow, and then you just choke all the time on food. So, but the medication for that is made by the Mayo Clinic. So it's a compound drug. Insurance companies don't pay for compound drugs. So it would at least cost me $500 a month. I don't have anywhere close to $500 a month to put into this. And I've gone through, we did the PA, which they knew. You just have to do these things. You have to go through the PA to make sure it fails, which it does because it's exclusionary, because it's a compound. And then you have to see if there's any grants for it. Oh, there's no grants. Even though Mayo makes it, Mayo has the patent for it. Mayo won't give you a grant for it. Oh, cool, thanks. So now we're trying to get another drug to see if that works, and then you got to do all these other steps, and it may not work because it's not the same drug. This drug wasn't created for this, but they're hoping it still may do something because it has kind of the same reaction in the body, where it's like it's not like it's immunosuppressant, but it does it in a certain way. So and now I'm trying to get a heart transplant again, but luckily because I have it's like 3 different insurances through Minnesota. They're starting to do the evaluation, and that starts in July. So, I mean, now, yeah, you only have to have 3 insurances now if you want to get heart transplants. So, and you have to have them all in like a certain state. Oh yeah, and I actually do have a grant with Mayo too. That's the stupidest thing. I had to get that too. On top of this, I had to apply. Their grant isn't the same as like Stanford's, but they have a yearly grant, which they'll make it so you don't have to pay like for certain medical bills. But it's usually only like clinical stuff. It's not quite certain other things. Like the compound thing doesn't qualify for it, which I don't know why, but yeah.
So, okay. Mike, thank you for that story. It's quite a tale. There's so much involved in all the things you just said. So much involved. notice, bouncing off of what our friend Anastasia said previously, right? This is Mike having to like assemble like a jigsaw puzzle of support, right? Not one thing, right? You have insurance, not one thing will cover it while you're sick, while you're you know, trying to keep your health up, right? Part of it is the stress of making sure you've gathered the right resources, right? In the right formation, right? Even if he like has a grant from the Mayo Clinic, you would think a grant from the Mayo Clinic would cover a product from the Mayo Clinic, but you'd be wrong, right? Because there's those tiny letter rules and regulations that apply, and apparently this is an exception. Compound drugs, which, from my understanding, and correct me if I'm wrong, right? These are drugs that are assembled from multiple drugs, right? And like done by like a pharmacist, like they put them together. So they're not like from a pharmaceutical company. They're put together. Yep, correct. Yeah. And that apparently isn't covered. Hooray! Sure, why not? Yeah, and then even more, when we were talking about the transplant and how that works, we literally just covered this. We had a discussion on this channel previously, like I think earlier this week actually, talking about transplants and how that works. And he's absolutely right when Mike says that the logistics of our system, the mechanics of it all, says that when a facility, some medical facility, does a transplant, from there on out for the next year, right? They have to keep track of you and make sure you're alive. That's the stat that they measure them by. So if a certain number of people die within a year, that hurts their rating. And if even more people die, then they can lose their license, right? Their ability to do these transplants, which is a very lucrative source of revenue, as Mike was pointing out to us, right? So, but in the end, what this means is that people get less care, right? People without means get no care. This is not as if Mike is suffering from something that is incurable or untreatable. We have the power to do so. No, now it's a matter of, do you have the resources? If you don't, if you weren't one of the ones to be born in a certain zip code within a certain family, well, then you're gonna have to fight it out. Your life is literally worth less, right? There is a market price for survival, and if you cannot assemble that amount of money, it's too bad. That's where our system. That's how our system is currently. Mike, this is. I'm sorry that you have to go through this. This battle again, assembling this hodgepodge of support to take care of, again, a very treatable condition.
Well, one of the things that we're trying to do, at least in Minnesota. Oh, mine says, oh, never mind. I was reading the other thing. One of the things we're trying to do in Minnesota is there's a bill that should be going into the budget bill. It just got passed through the House. It was called HF 1030. The author of it is Jamie Becker Finn. She's really cool. One of my friends was the one who wrote the bill for it. It's an anti-discrimination transplant bill that will be embedded into the Minnesota Bill of Rights, which basically makes it so hospitals and insurance companies in Minnesota can't discriminate against people who have like IDD or like who are blind, certain disabilities from getting transplant too. So that's another thing that kind of happens right now, is where if you have a certain disability, you can also be basically considered. I think there's a name for this thing that insurance companies have. and I can't. It's like Q. No, it's like a quality of life thing. I can't remember it, so I better not say it. It's like a 4-letter acronym,
Mhm.
but it's how you measure quality of life based on how much the drug is going to cost and how much the quality of life is raised from but they also, so it's like based on a number where it's like 0 is dead and then like 1 is like amazing, so they do it in this really weird way, and it's like divided
Mhm.
the cost by the quality of life number. And if it's like above that number, then they basically don't insure it. It's something like that. And they knock you down if you're disabled. So they're like, yeah, well, I mean, they're disabled, so the quality of life they assume is lower, so they're less likely to cover it then. Like, and transplant, like it's one of the most costly things, so because of that, they're less likely to cover something like this. So it's actually insane, like that they get away with discriminating against this.
I'm I'm nearly speechless here. Wow. This wow. So they come up with some sort of ratio, it sounds like. And
Yeah, QALY.
Okay.
Somebody's in chat said it.
Okay.
And I may even be describing it wrong, but that's how I had learned how it was. But I don't know if I have that right.
But okay. But one way or the other, it puts a value on each individual person, right? And it's like whether saving your life is worth it to us. That's what we reduce people to in society, right? Once you put the profit motive within this equation, right? Well, then it's about whether it's actually worth it, right? Well, I'm not sure the quality. I deem that the quality of life might not be raised enough. So, is it really worth the money? Should I bother?
Yeah, that's also why, like during COVID, when they're deciding who lives and who dies, they pick people who they assume has lower quality of life to let die. And that's kind of basically what the QAYL is, but it's like that, but measured mathematically with like for algorithms for pharmacies or insurance companies. Sorry.
Yeah, and this they tell us this system makes sense. That this is what being free looks like. For some, I guess, some individual working within the bowels of an insurance company, right, to tally this number, and oh, it isn't the metric isn't what we're looking for, and so we don't care. We don't like interview Mike. We don't actually bother to understand even the details. Even if we did, still, that's too much, right? Like it's not that Mike should be, and he is. An amazing individual, a person who's doing so much with their life to deserve this, right? Mike's life in and of itself is worth the effort. But under this system, we make these sort of choices, and we're told, well, it's just too expensive. Right? Like, and it makes sense from their perspective because they have stockholders that need to be paid out, right? And their business model says that they want to take in your premiums, right? They want to take in your payments and then pay out as little as possible. So individuals out there, maybe you're one of them who happen to be quite healthy and almost never need to go to a hospital, right? Those are the ones they're looking for. The ones that actually don't use the service, at least not yet, right? Because eventually we'll all end up needing it. So while you are healthy, while you are fit, and while you're able, as Mike has pointed out, while you're able-bodied, then they're more than happy to take your money. The moment that changes, is it worth it? Did they reach the proper metric there? Thank you so much, Mike. That was amazing. Thank you so much. And again, to my audience, we are organizing for the Be a Hero Fund. If you've just joined us, exclamation put M4A in chat if you want to be a part of the movement. Okay, so join into their Discord server. We'll be hopping over to their Discord server after this portion, and we want to hear from you. We want to hear from individuals like you, right? Your stories, right? We've heard some people in my chat, in my Twitch chat. I heard some people from Canada who would like to share their stories about how their system works. That's fine. Whatever it is, if you want to talk about your healthcare stories, we'd love to hear from you. But we're organizing within that Discord server, trying to get people plugged into the larger movement. So exclamation M4A, click on that link to go to their Discord server. They would love to have you, and I can't wait to see you over there. All right, we're gonna go to our next storyteller. Right, everyone doing all right so far? Just making sure everything good. All right, good. All right. So next we will go to our very good friend Empress. Empress, please.
Hello, friend.
Yes. Tell us your story.
Yeah, so for those of you who do know me in the audience, my name is Empress.fm. I am a soon-to-be fully certified political scientist. I come on this channel a lot, and I stream myself, talking about a lot of these kinds of issues. And you'll see that people tend to remark that I'm very educated on these issues and that I'm very passionate about them. And the reason I'm so educated on many of these issues is because of my own experiences with these systems. So just really quickly before I get into my own story, I guess I do want to remark that the stories that have been told so far, and probably more of the stories that you will hear tonight, are not the exceptions. These are the rule. This is very commonplace in the United States, and I know this because I've talked on this channel about my research before in human-computer interaction and privacy theory. What I don't often mention is that a lot of the data that I collect is very closely related to our healthcare systems and the kinds of algorithms and, as Mike was talking about, information exchange in terms of you have to tell your whole life story and that this makes you hyper-visible within these systems. This is like very, very close to home for me in my research and expertise to an extent from an algorithmic perspective. And I've also done research in the past as to how to build systems around community needs and specifically the needs of people with disabilities. And I sort of came onto this path by chance, as much as I tried to find and do something else, but because I've always been very passionate about trying to make sure that people don't have to go through the same kind of things that I went through. And I didn't even have it that bad compared to some of the stories that we've heard and some of the stories that you will hear. So I'll start at the very beginning. When I was around 10 years old, I started experiencing these really bad stomach pains, and they just kept getting worse and worse and worse and more frequent. And my mom would have to take me to the emergency room some days because the pain would get so bad, and they would they couldn't figure out what it was at first, so they were going to do an endoscopy, but they used some I believe it was Pepsid, right, to suppress the acids in my stomach. And though the pain was still there, it was more manageable. A few years later, around the age of, so it was like 9, 10, around the age of 12, I started getting really bad ear pains. It started with an ear infection. The ear infection was gone. The pain didn't go away. And this went on for months and months, more and more emergency room visits, more and more medications being pumped into me, trying to see everything that would work. As the pain got worse, I eventually had to leave school to be admitted into the hospital because there was no way they were going to be able to run all these kinds of tests and figure out what's wrong with me unless they had me inside the hospital. This sort of starts two issues in my story, right? The first being the expense of hospital costs. Being inpatient is very expensive, and inpatient services are also very expensive. So sometimes you'll actually pay more to do the procedure inpatient than you would if you did it outpatient, simply because it's a monopoly. They're usually going to add bed fees and transfer fees between rooms on top of that. So the same procedure becomes very quickly much more expensive. It got to the point where my dad, who, my parents didn't come from much. They both grew up in the South Bronx. Their grandparents had both abandoned, their parents. My mom was the daughter of a single mother. They did not come from much. But at this point, my dad had, started to make money, was starting to come to a point in his career, but he had recently been laid off during the 2008 financial crisis. And we didn't necessarily have a guaranteed source of income. And when your 6th grade child is in pain, and you will do anything in your power to try and get them help. But it got to the point where he had less than $1,000 left in his bank account. And a doctor said to him, this man had no specialty in dealing with chronic pain. This man had no specialty in the kinds of things that he was experiencing. This was just a general overseeing doctor who specialized in cholesterol. He said to my dad that he thought the pain was all in my head. My dad almost beat the shit out of that doctor. We transferred hospitals immediately because he was so angry. We had an in with another hospital, and they were able to get me a bed. Getting beds can be extremely difficult, not just because of availability, but also because of the cost of a bed. So while I'm very lucky that I was always insured, insurance didn't cover everything. A lot of things had to be paid for out of pocket. But often they will not admit you, and you will be turned away, despite the fact that it is illegal, for care that you may need. So the fact that I even was able to get a bed is already twice now in 2 different hospital systems is already very lucky. But of course, like I said, it came at a cost. The second thing that I encountered was the inaccessibility of the education system. Now, you may be wondering in the audience, what does this have to do with insurance? Why am I bringing this up? Insurance, private insurance in the United States is how most medical services are paid for. However, often certain types of therapies are either just not covered by insurance, or you're going to have to pay out of pocket for them. So for things like developmental disabilities, some types of chronic pain syndromes, et cetera, we provide these services through our education system. But I went to private school, which meant that my school was not obligated to provide these services to me. And my mother actually works in education, and with her students, she was often required to do basically have parents sign illegal contracts saying that their kids who are entitled to one-on-one services would instead be in groups of 5 at a time. This is not viable for speech therapy, obviously, right? But these problems are created through the private insurance system because in education systems, while they need to be accessible, right, simply don't have the resources to be able to afford these kinds of services, especially in poorer areas, right? So I was kind of in this situation where my accommodations were being met at the will of my school. They again did not have an obligation to meet these, and this resulted in a lot of stress and struggle over the course of now dealing with the chronic pain syndrome, dealing with undiagnosed developmental disabilities, and at the time going through puberty as a young trans woman that probably I didn't want. So it's also like the inability to spot these kinds of issues because of so many different comorbidities and focusing more on the cost of care rather than the quality of care and actually trying to narrow down. It's like just throw as many different things as you can at it often rather than taking a step back and looking at these systems because, again, a lot of these systems aren't integrated and don't talk to each other because of the way that insurance is fragmented in the United States and healthcare is fragmented in the United States. Most states require that you only serve within their borders, and this is also some federal laws require this as well. I think there's only 2 states where you can operate across borders. Now, I'm not saying that this is the solution to the insurance problem. However, this does create issues with segmenting of insurance. For example, when I eventually graduated from high school and started going to university, I was given the option to get a university insurance plan, but because I had insurance, I was able to opt out. You either had to get the university insurance plan or show proof of insurance. So I showed proof of insurance. Nothing of the past 5 years of my healthcare, with a few exceptions, has been covered during that period because it was completely out of network. I'm in university, right? Like this is where I'm supposed to be focusing on my work. And I can't do that because of local health resources. But luckily, right, my family was a little bit more stable in income at this time, and I was able to pay for many of those services out of pocket, despite how inaccessible they still were. But what I ran into was, if you were in a position where you couldn't afford the university insurance or didn't have coverage to see anyone for example, psychological needs except within the university, you would not be entitled to legal accommodations. They could not award them to you. Despite the fact that there's nothing in the ADA that prevents them from doing this. The chair of our Office of Accessibility Resources simply, I don't know if this was an arbitrary decision or if it was a general counsel decision, But this creates a systemic issue because now you have anyone who can't afford insurance, particularly people from lower class backgrounds, people of color, especially because my university was a predominantly white institution, as are all the schools that I've been speaking about so far. This creates a systemic discrimination issue. So over the years, I interacted with the system more and more, and I saw that it was more than just an issue of one, thing regarding insurance. It was significantly more endemic than that. There was systemic discrimination going on from this individual, systemic racism, abuse of disabled students, which again, if we had a Medicare for All system and these students weren't completely reliant on the will of the university, right, may not have occurred to this extent. Obviously, she was still a very abusive person, and my work in advocacy over the course of the past 5 years, she was fired last year, and she is about to be replaced with a new director of accessibility who is starting next week. So this is one of those examples where it may not seem like it's necessarily worth fighting, and it can be very hard as someone who is disabled to mount that fight. But me and another friend of mine who both have physical and learning disabilities, she uses a wheelchair. I often have to use a cane. She's not wheelchair bound, mind you. There is a difference. A lot of people don't know that there is a difference. But we had to consistently fight against the university, gather stories from different students from different backgrounds before any of this could really change. And eventually, this individual was under review, and we brought those stories to the person who was overseeing them. And she did not last much longer at the university because at that point it became a legal issue, right? With the ADA. So I guess what I'm saying with this is that it's very, even small amounts of advocacy can go a really, really long way. And I was doing many other things at my university as well. But this was one of those situations where people were in a position where they just didn't have the resources to advocate for themselves. And we see that time and time again within our healthcare system, that people who just aren't in a position where they can defend themselves wind up just getting beaten down by the system over and over and over again and put in disadvantageous positions by the nature of the system, which does not give two shits about them. I know Mike mentioned earlier being in studies for medications. I was also in similar situations where I literally just turned 13, so I just qualified for the study, and they were trying to see if it would work for my chronic pain condition. I don't think I mentioned what my condition is. I have something called chronic regional pain syndrome. It's also been called reflex neurovascular dystrophy. If some of you are in the audience might be familiar with the McGill pain scale, it is a 42 to 48 on the McGill pain scale. It is considered to be, in some cases, worse than unprepared childbirth, worse than amputation of a digit. So it's not a pleasant condition to have, to say the very least. And this is where my stories about sort of medication coverage start to come in. I've been on many medications throughout the years, and I've run into situations where insurance didn't cover it, you had to pay out of pocket. I've run into situations where I have experienced medical discrimination because of the medications I was on, particularly ADHD medications, anxiety medications, and medical marijuana. And having a chronic pain syndrome, these four things together, they don't take you seriously as a patient anymore. And it was jarring to experience that firsthand. Another thing that was jarring, and I haven't experienced it to this extent yet myself, but I have seen it, is being a trans person in the healthcare system with regards to insurance and healthcare. Because again, you can't separate, as we've seen from many stories tonight, you can't separate these two things. These systems are, I guess the way to put it is inextricably linked and I guess not comorbid, but codependent systems, right? The way that your health delivery systems are built is dependent on your health infrastructure and pay structures, right? So that in turn affects things like quality of care, right? And this is why trans people, people of color, are not only systemically disenfranchised from a paying for care perspective and from discriminatory legal perspective, they're also just, actively discriminated against because of their perceived inability to pay. And that leads to other types of discrimination as well, and other types of discrimination compound that factor, resulting in lower quality of care that does result in people dying, right? This is something we've seen time and time again. It's been shown again and again in research, and it's something that's not often talked about. I had a friend that was, because anytime that a friend of mine has experienced health issues, right, as someone with a disability, I'm always there for them. Because I feel like that's one of those times where people tend to turn their back on you socially. It's like they don't know how to deal with it. They don't know how to support for that because, again, healthcare education is not something that's prevalent in the United States, right? We don't teach people about these systems. We don't teach people how to interact with them. They don't know how to. So when people encounter it in their day-to-day lives, they have no idea how to deal with it, right? We don't have good medical education in the United States because people aren't engaging with healthcare systems. People don't understand how these things work. So I've always been there for my friends who, when they experience their own issues with health, and I took a friend of mine to the emergency room. I sat in the front of the ambulance. She was in the back, and she was trans at the time, and the vitriol with which she was treated by her doctor was absolutely disgusting. This is central Pennsylvania, right? So you can expect bias, right? But it didn't just go to the, oh, you're trans, I'm not going to gender you properly, right? It affected her ability. Like I saw the way that the doctor spoke to her. I was sitting right there, because we had a very strong bond at the time, and she just talked down to her, didn't take her symptoms and concerns seriously. It took like 6 to 8 hours before this person even recommended talking to a remote psychiatrist, and kept saying, there's nothing physically wrong with you. There's nothing physically wrong with you. And this is something that I experienced myself in a very different way when they couldn't figure out what was causing my chronic pain, right? So it's like this judgment of the person based on the system, and it's just utterly disgusting. Because a huge part of what drives that is, if we don't figure out what it is, we're not going to get paid, right? Which is like, it's a lot harder to get something covered if it doesn't have a specific underlying cause. And the reality is, a lot of the time, we just aren't able to find those things in healthcare. Like, it's a very, like, people have this idea of it as being this very exact science, right? That it's like, you can carry the one and you have your exact calculation, and this is how things are spat out. It's just, that's not how these systems work. And it's a problem that results in algorithms being applied, as I mentioned earlier, this is kind of more my research area, systemically, that people don't understand how these things are being calculated because they're being designed by so many people. They're unable to be criticized from the outside because they're very opaque systems, be it for copyright reasons or because they don't want people to game the systems, right? And it's just silly. It's absolutely atrocious. It gets people killed. It literally, like, people were talking about, if we have Obamacare, we're going to have death panels. What they didn't talk about was we already had them. We already have they literally said rooms of people. I don't know if this is done as much anymore in the insurance industry. I've heard they've moved away from this in favor of QALY assessments. But they literally used to have like rooms of people that would sit together, evaluate your case, and they would determine whether or not you got care. And I actually ran into this firsthand. So in seeking treatment for my chronic pain syndrome, getting back to the main line of my story, I was referred to a specific physical therapy hospital. At the time, there were only 4 programs like this in the country for my condition. There have been more since. The first one was at CHOP, Children's Hospital of Pittsburgh. I have my own problems with these. I believe that these may have been designed around like profit motive rather than care motive, because all the studies on these systems seem to be coming from the same companies who stand to benefit from these systems being effective, right? The hospital corporations, it's the fox watching the hen house. And as a patient, you will often have incentive to lie to get out of these programs that your pain has gotten better. Otherwise, they won't discharge you. This is also true, for example, mental health systems where you have no rights. If you are admitted into a mental hospital, and I unfortunately have had the displeasure of experiencing this after a suicide attempt when I was younger, you lose all your health, you lose all your civil rights, you lose all your healthcare rights, everything gone. They have complete control over you. You are effectively a ward of a private company, right? And when I got there to this hospital for physical therapy treatment, we thought that the insurance was pre-approved. But they told us that day that they had never actually gotten approval, right? So it's not clear if they had been deceptive or if something had changed. I'm under the impression that they were being deceptive just to get me in, and they weren't going to admit me. So my father had to fight with them to allow me into the hospital. The program was normally supposed to be 4 weeks. I was only there for 2. However, it was $20,000+ a night, and this is not even including so it was basically I had 1 hour of aquatic therapy, 1 hour of occupational therapy, 1 hour of psychotherapy, 2 hours of occupational therapy, and 3 hours of physical therapy every single day. This was an intensive program, and each of those was billed individually, right? And I wasn't even allowed to take Tylenol during it. This was like, again, most nurses would not, physical therapists would not partake in these programs because they considered them to be abusive and almost like terroristic, right, in nature. And they felt that they were terrorizing children with these programs rather than actually helping them. And every person I know that's been through one of these programs did not experience long-term recovery and still experiences massive chronic pain, despite these programs claiming that they are extremely effective at reducing pain and that most people are able to further in the future manage their pain and maintain low pain levels. This is just not, the anecdotal stories do not match up to this, right? So it's very often, this is so mind-boggling to me. We will prescribe certain types of treatment that are not FDA approved or not externally validated, which is okay, fine, right? You want to do that, but it also means that it's less likely to get covered. And it also means that you're effectively doing human experimentation, right? That is often abusive. And this happens to many neurodivergent individuals who were in their youth experimented on. And I'm not just talking about things like autism and ADHD, which is what we often talk about in terms of abuse. We're also talking about things like bipolar disorder and schizophrenia, literally abused for medical research. Like the common vaccine study that you always see said, like, oh, vaccines cause autism. This man's was literally performing invasive surgeries on children that were resulting in them vomiting up bile and could have had long-term health implications. And in some cases did for some of these children, right? It's absolutely atrocious that our system allows these kinds of things to occur. This is entirely, right? All of these things tie back into the central healthcare system. So when I was discharged from that, in my opinion, abusive program, we fought with insurance and they were like, oh, well, you've never received this therapy before. And we were like, well, I have. They were like, oh, well, you've never received this therapy before. And I was like, I have. We had to go back and forth with documentation. Then it got to the point where they're like, well, you never received occupational therapy before. And though I had, we didn't have the documentation to prove it. We just couldn't find the paperwork. I had received it. I had many different types of therapy. We tried everything. We spent thousands, if not millions of dollars over the course of my lifetime out of pocket. And that's not even including what the insurance covered, right? They showed up at our door in the middle of the night, this random strange man standing outside of our house. And he says to my mom, are you Lee Rogers, mother of, fuck, shouldn't have said that, whatever. Mother of Dylan. And I was like, yeah, it's okay. My name's out there, whatever. And he said, well, we have these legal papers that we are serving to you. If you don't start paying by this date, we are going to sue you. How do you respond to that? You're talking hundreds of thousands of dollars that's being requested, or you're going to get sued at your door by some strange man you've never, again, literally just wandering around outside of our house. It was terrifying. We eventually, luckily, I had my mom's insurance, I believe, at the time, which was through the state of New York. And we had my father's company, even though we didn't have insurance for him, because one of the things a lot of people don't know about insurance is with regards to your employer, is that it scales usually, if it's a decent company, based on income, right? So you'll pay a lower percentage at lower income levels, and as you get paid more, you'll pay a higher percentage. So what this results in is, one, right, sometimes you'll get fucked where you get a raise for $1,000, you're now in the next bracket, you have to pay $10,000 more for insurance. In my father's case, because my mother was employed through the state and he was a very high-ranking executive at that point, he didn't take the insurance. because he would have had to pay basically as if he was buying it directly from the insurance company as an individual. It was like less than 10 or 5% covered by the employer. So we were like, okay, yeah, we'll get my mom's insurance, and they were the ones that we were fighting with. And this is like one of those insurance companies. I don't remember the exact name. I believe it was Blue Cross Blue Shield, but often like for certain types of care, especially like trans care, they're talked about as being very good. But that's just not the experience that I had with them when it came to something else. And we had to get New York State and my father's employer involved. Bear in mind, my father's employer has no like no real say here, except for the fact that they work with insurance companies. My dad, has been a consultant for insurance companies, and he talks often about how these are legalized gambling systems. Right? It's literally just, well, we're going to make money at the expense of individuals, and he's very aware of that fact. So he knew how these systems work. He knew exactly how to fight it. And luckily, eventually, after 2 years of fighting, we were able to get it covered, but not without a monetary and drastic emotional cost on our family. It's literally just trauma and abuse over and over again. And this is one of those stories where I tell my story, and we didn't have it that bad, right? This is one of the lighter stories, right? This is one of those stories that we survived, right? We got out of it, right? But now I'm in that situation where in 2 years I turned 25. And like I mentioned earlier, my medical marijuana, because it's a Schedule I drug, it cannot be covered by insurance. I have to pay thousands of dollars a year out of pocket just to cover that medication. If any of my other medications stop being covered, like I was looking at them recently, my ADHD meds, $800 for a 1 month supply. My HRT medications, it depends on the state, right? Because there are some states that will make it deliberately more inaccessible in terms of insurance coverage, and I would have to pay for it out of pocket, and I might not be able to take the same meds anymore. And like I don't say it lightly when I say that those meds literally saved my life. Both of them. So I'm just like, well, fuck. What do I do? So I fight. I do things like this. I advocate for those who don't have someone to fight for them. My sister saw what I went through. She wants to become a disability lawyer. And that's what she's going to fight to do. And we're going to keep fighting, and we're going to make these things happen. So yeah, thank you for doing this, Prime. It really, really means the world to me. And thank you for allowing me to share my story. I believe we can't hear you, Prime, if you're talking. Or is it on my end?
Sorry. Anyway. Yeah. Thank you for that. Thank you so much. All right. Anyway. This was. This story encompasses just so much of the issues that we face within our within our system. The part that, and there's so many parts. I don't know. This is something we could dissect for a very long time because there's so many pieces to this. But the part that spoke to me was when you talked about advocacy. Looking at our system, right? There's many parts where advocacy, that word, comes up. You have to advocate for yourself when you're dealing with medical professionals, right? Because you can't assume they're going to give you the care that you need, right? That they will listen to you. This is encapsulated in your story about your friend going to the hospital, you being there, and I imagine being an advocate for them when you have literally a hostile professional, quote unquote professional.
And I should add, right, that the other professionals in that space were appalled by what this doctor was doing, and it changed nothing. Right? She was the end all and be all, and she had the say as the doctor, right? So there was literally nothing. Even the nurses were grossly apologizing, gave us the resources to report her, but there was nothing they could do.
Yeah. Yeah. So that's one part of advocacy, right? The other part of advocacy is advocating against the insurance agent industry, right? Like this is a multi-year battle, right? A very expensive one.
Yes.
Documentation flying back and forth, accusations that you're lying, right? That no, you didn't.
Like I had every procedure under the sun,
Yeah.
MRI, spinal tap, you name it, I had it.
Mhm. Yeah, like you have, yeah, everything under the sun, and you, but been told again that you're lying, that you're trying to get away with something when you're asking for care. We were asking for care that, of course, was paid for through the premiums, right? But the insurance industry lets you know that, well, I don't think you're telling the truth. I don't think that the information that you have here, right? Like, oh, I'll ask you, have you been part of this program? Sure, great. But I have another program that you need to be involved in. So you have to go through several layers, right? Several layers of like a bureaucracy.
There was months of preparation beforehand too, right? Like the fight like started well before I was even in that hospital, right? Months before.
Imagine, right? So Empress is talking about how she's one of the lucky few, right? Imagine individuals who don't have resources that Empress's family had. Imagine going through that. You don't win. You don't win. Empress was lucky enough to have a father and a mother in a certain position in life. Thinking about people who are making below a living wage within our nation, another fight for another day, right? But imagine people are making below minimum wage, battling it out in this exact same situation. Imagine trying to find that documentation, right? Were you able to assemble it, right? People who are within that income bracket may not have stable housing. Imagine not having stable housing, right? And then being told by the insurance agent, why don't you have this documentation, right? Prove it. No, you must be lying, individual, right? You must be lying. You've had to change houses multiple times, and you don't have this documentation. Well, I don't know if you've actually done it. Care denied. Care denied. You having a sick child. Imagine. Do you have siblings, Empress? Did you mention that?
Yeah, I've got a younger sister.
Imagine being in a family, right? And I've seen this firsthand myself, right? But having a sick child, right? So there's a sick child. You are the sibling of that sick child. Maybe you're not sick yourself. Watching this happen, right? In terms of a family dynamic and all the effort and stress of the family, right? Drawing attention away from other family members. This is the part that I know there's so many parts of your story, but this is the part that has been speaking to me, and how that affects other members, right? So it's not just Empress here. It's not just the individual, right? It's their family. It's like not just Mike. It's the stress and the pain that their mothers have to go through, their fathers, right? Their support network that they might go to for cash assistance during all this, right? So it's not just one person, not one individual who's suffering. It's a whole network of individuals. So like that's another thing that like that this story has actually really helped me realize that I hadn't actually put together. But it's a whole network of people who are affected when the profit motive is involved in insurance. When they get to tell you, no, we don't think your life is worth it because you haven't met our rules and regulations. So we won't pay for that care that you deserve. Wow.
And a lot of people don't have those support networks, right? Especially, for example, like people of color and trans individuals, right? Like often those support networks won't be present for people, and that makes it even harder for them to get access to this kind of care. And even if you do have access to those support networks, I think it's also important to acknowledge that this results in a level of lack of autonomy, right? This means that like I have to, as a trans woman of color, right, in the kind of household that I am, maintain a good relationship with my parents in order to make sure that I have that healthcare for the next 2 years, right? I have to, ensure that after I do turn 25, that I maintain a good relationship with my employer, a good relationship with all these different systems. Otherwise, I risk losing care completely, right? And that level of reliance and lack of autonomy is a huge, huge, huge problem.
Mm.
So yeah, this the last point we'll touch on. Then we'll move on to our friend Johnny. And Empress, I'm not sure if you have the time, but afterwards, if you would like to be a part of the the audio only format, that might be useful. I don't know if
If
you
I
have
can, I'd love to stay for a
Yeah,
bit.
if you
I don't know how tired I'll be. This is a lot.
sure. No, but this has been amazing, because there's so much more of your story to dissect. But this part so important. There's a lefty space, so you're already aware how so many of our trans brothers and sisters have lacked those support networks because their family has rejected them, right? That they
Many
have
friends of mine.
Exactly. Yes. There's so many stories, right? If you know trans individuals, then you probably know someone who's gone through that. I know several people have gone through that. So they don't have that support system, right? But Empress does. But you have to maintain that. It's like life. Your life depends on that. That those connections are maintained. And then going on to something that might be more familiar to the rest of you, right? Is your job. So it's not a matter of, well, I don't like this job, so I'm just going to quit. Like that this job, I might have an abusive boss, so I'm going to quit. I'm going to find better employment. No. If you leave, you might die. You will lose access to care. You'll lose access to your insurance. Imagine if you've won the battle, right, against an insurance company, as Empress has, right, and then leaving your job and going to another company with another insurance, and then having to start that battle again if they feel like it.
Yep.
This is the terror we put people
They often
under.
do.
Yeah, exactly. This is the terror we put individuals under. And so we don't have that freedom, just economic freedom to go where we want, work where we want, right? Or maybe to start a business if we want, right? If Empress wants to start a business, well, then you probably have to go within the private insurance market, like individually. So it limits your possibilities. It limits a family's economic possibilities, right? How much money that was poured into this fight, to this battle, that could have been poured in other places, all gone. Thank you, Empress, for that very powerful story. And if you can join us later on, if not, that's fine. But we'll talk again at some point. But this is amazing.
I'm always here. I'm always here for you, Prime.
Of course. Thank you so much. Okay. So I will go to our last storyteller. We'll go to our good friend JohnnyScarlett. I'm so happy to talk to you, Johnny. Please tell us your story.
Friends, am I muted?
You're good.
Yes,
You're good.
I am good. Awesome. Well, it's wonderful to. I'm not going to say wonderful. That's sort of a bad nomenclature for it, but it's really getting to me a little bit to hear so many people talk so explicitly about things that have affected my life directly. I've very much appreciated it. Actually, it's been very cathartic. I am a PTSD diagnosis, and this is after several diagnoses, and I'll get into exactly why that's been helpful. PTSD for a long time was this unknowable sort of burden. It's like the analogy of the fish in water, and you talk to him about water, and he's like, "What's water? You haven't shown it to me yet." The disease is generally known by its association with veterans. And generally that is sort of it's a very acute version of the disease because it centers around individual implications or individual actions in that person's life, or a small group of happenings in that person's life. But that is not my experience, and that has made it a little bit more difficult to get treatment, and treatment that's appropriate for me. In my case, it is due to, excuse me, the cat really wants attention tonight. In my case, it's due to severe lifelong abuse, physical as well as mental, and it has affected my life in every possible way. Um, with PTSD, my doctor once told me, with PTSD, your brain is addicted to chaos, and this is something that I can very much attest to. I lived every moment of my life, probably for most of what I can remember, around it, but I didn't even know it for a long time. I lived around triggers, and this is one of those cases where I get to talk about how everyone has co-opted the word trigger, and it has been very harmful. So I would do things like, and I still do it occasionally, but I've been in recovery for about 6 years now. Anytime someone's hand went up very quickly, I would flinch, visibly flinch. It was very awkward many times, and I actually had a boyfriend get very upset with me because I thought he was going to hit me, and he would never do that. I couldn't think without hearing screaming, quite frankly. Every moment of my life was built around hearing someone screaming at me. And that lived in my brain for a long time. I slept around 10 hours at a time with no control as to how I would wake up, or not at all for days. And when I did get sleep, it was very tumultuous, lots of nightmares, lots of things like that. I lived with this, of course, like I said, probably most of my life. But when I was 16, I left home. I was lucky enough to get to live with my granny for a year, and then when I was 17, I graduated, and I was also lucky enough to have my granny help me do the letters that we heard about with Mike, those special case letters that so often people have to write in our cases. My granny helped me that year with writing all of the letters that explained why my parents would not be part of my life, either financially or in any other case. And then I, of course, immediately dropped out because I could not handle anything. I couldn't be in a room with an older person without being scared. I could not be alone in a room with a person. I had a lot of social anxiety. I couldn't focus on anything. And I did have a lot of just completely unexplained bouts of crying. Of course, that was usually hand in hand with some trigger that I had not recognized because I didn't know what triggers were yet. My life was saved when I made friends. God knows I needed some friends. I made some friends with some people that I was working with at a pizza shop. I couldn't hold a normal job, obviously. And so the hours that I was getting were at a pizza shop, and I was lucky enough to make some friends with some people there who cared enough about me to not only hear my story, but also to say, you need to go to a doctor. I was not raised to trust doctors. I was not raised to think that anything was worth going to a doctor unless it was physical and could not be covered by a Band-Aid, and maybe stitches were not really a thing. I had at least a couple of injuries looking back on it as a kid that probably would have warranted stitches had we gone to the doctor, but we just kind of closed it up. It was fine. But yeah, I didn't trust doctors, but I went because I didn't want to lose these people in my life. But these horrifying, extremely out of the blue emotions that were very, very intense, they were affecting my ability to have any sort of relationship at all. And so I tried to go at first to the college. I was like, I used to go to college here, I'm really having trouble. And they sent me to the clinic that I go to now. And so now I go to a public clinic. And the first thing they did was sit me down and say, you need to have insurance. I was lucky enough that I had at least been doing my taxes. I had at least been doing that for a couple of years. So I got to get on Medicaid. Obviously, since I wasn't working at any normal hours at a normal job, I was under the poverty line and had been my entire adult life up to that point. I was around probably 21 when this happened. And they got me all signed up for Medicaid. And so because of Medicaid, I have been able to not only go to doctors and psychiatrists, who, by the way, are not therapists, but also go to social workers for therapy sessions. And because of that, not only have I received care in general, but I've received proper care. And that is because I've had the opportunity I'm 26 now. So in fact, it's been about 5 years. Over the last 5 years, I have not only gotten to go to psychiatrists, to actually get medication and to get diagnoses, but I've had further advocacy in my life given to me by wonderful, wonderful social workers who have served as my therapists. And because of that, I was at first, because of my large bouts of emotion, I was misdiagnosed with borderline personality disorder. And I had an absolutely fabulous therapist a few years ago. He left to start his own practice, and when I get up in my money, I plan on going to see him again. But he was working at the local clinic, and he said, I noticed a couple of years ago you got diagnosed. I don't think that's right. Everything that you've told me so far is not because of some just random imbalance in your brain. You have PTSD, and severe form of it. Some of the things in that same session, he told me that some of the things I had described to him violated the Geneva Convention. And so I was properly diagnosed after years of going to psychiatrists and therapists. And without the opportunity to not only have those things paid for, but to have them paid for long term, I would still be thinking that I had borderline personality disorder and taking a medication that didn't even address the issues that I had. All of that changed after I got my PTSD diagnosis. I'm on a completely new set of medication, and it works for me, and it's paid for. And I do live under the poverty line. I do. I scrimp and I save and I do my best, but I haven't had an amazing ability to have full-time jobs and to, take on a lot of time in order to be paid. And I know, so I've never taken like manager positions. I've never done anything like that because even though they've been offered to me, I knew that I wasn't physically healthy enough to take them. And so now it's gotten to a point where I would like to improve my life somewhat, my situation, and maybe move out of this tiny little apartment, maybe, get somewhere with a yard where Mr. Chu can walk around outside. That would be great. But in the midst of all of this are, I'm going to lose my insurance if I start making above the poverty line, or at least most of it. I have experienced rationing, of course. There were a couple of times where there have been miscommunications and difficulties with my parents putting me on, because obviously they had my socials and they kept all of my first credentials and everything, my original birth certificate. So they've been able to, sign me up for things I didn't know that I was signed up for, if you know what I mean. So I've had a couple of run-ins where I couldn't get my medication 1 month because there's been some sort of clerical error. And rationing is definitely something that I've experienced. And I would like to not ever have to deal with that stuff again. I would like to, now that I have mentally started healing myself, and I do mostly consider myself healed. Um, I, I am dealing with the physical aspects now. I'm realizing that depression comes with joint pain, and sleep and lack of sleep come with, all sorts of things. And I would like to improve my life somewhat financially, and that's going to kick me off my medication. And I thought, well, I might join the military. That'd be nice. Um, I was informed that I am too sick to join the military. I am not on a good mesh of medications for them. So now I'm at this point in my life where I may have to make a leap wherein I accept help in a form that I've never accepted it before, where I may become legally disabled. And this is hard to explain as an emotion. I realize that it is probably what is best for me. But when it's not something physical, when it's not something that's identifiable, it makes me feel like I don't deserve it. And I'm sure, Empress, you've dealt with that as well. So, while Medicaid saved my life, it is also something that I cannot subsist on forever, and I'm gonna have to deal with not having it, or else I'm gonna have to deal with not having my medications, because I've looked up what those things cost, and I wouldn't, even making hundreds more a month than I do now, I wouldn't be able to afford them. But for right now, I'm doing just fine. I have I have built a network around me, not only medically but socially. Um, I deal with it pretty damn well, and I appreciate myself for that. Because Lord knows, statistically, I ought to be somewhere completely different in my life. And I thank you, Prime, for letting me come on here and talk about it, because I think that this is so important to not only to spread the word about Medicare for All, but to be actively supporting one of the organizations that's so well involved with it, to have people like Nicole come on and really advocate in a way that we don't always get to online. I think this has been fantastic, so thank you.
Thanks so much. Okay. Yeah. So this is something that's come up a few times, right? Talking about that poverty line, right? And being able to access care, being below it. So, I mean, this is something that you'll see Republicans attack the system for, right? As to why we shouldn't have more help for individuals, right? The system as it's designed discourages work, right? Like, they're right there. Like, it discourages you. Like, this is a person who is industrious and working hard to the point where they're being recognized within their workplaces and offered positions. But if you go above that line, if you start making more money, well, then you don't get the care that you need.
Mm-hmm.
And what kind of system is that? It's I think this system and all these different stories put together show us, right, like the myriad, the varied types of brutalities that are put upon you, the indignities that are put upon individuals, that everyone had to suffer, and not just you, but of course family members, right? And so you have situations where it feels like your life is on hold because of the insurance, the battling for care, right? That in a system where you could otherwise this would be paid for, be taken care of, and the reason it would be taken care of is because you're a person, right? Not because of anything else, not because you're a person with money, but you're a person. But because we don't live within that system, right? Like, your focus needs to be on this battle, on this endless struggle, right? And it is simply endless until you finally die and they don't have to deal with you anymore, right? Oh, but then again, of course, there's the medical bankruptcy. This also bounces off of Empress' story, right? The medical bankruptcy that can happen. So that the individuals left behind still have to continue on that struggle, right? For
I
the
had someone in my chat come in during this who said that they had to go bankrupt 2 times because of medical care.
exactly that. So the fight does continue on, and then it literally puts you could trigger generational poverty. Like, this is the system we have. This is the system we have. Rather than simply deciding that in a nation, the richest nation in the world, let's not forget that part, and we could simply provide this care, that we could actually just do that. We have money for lots of other things within our society, lots of other things, but not simple care that individuals need, because humans break down sometimes.
That that remark that you made after Empress, when you said that you had realized that this affects a web of people. I've known that about abuse for a long time because, of course, oftentimes abuse is generational. And so I appreciate the connection that you allowed me to make, wherein, like, that web of dysfunction or that web of pain and stress can come across in purely medical things as well. And I think that it goes back the other way. How do you solve that? Well, you solve that by, making the medical system better and making it less stressful and making it less of a burden. And it's the other way as well, by making our social structures better and by encouraging people to be healthy and to go to doctors and to go to therapists and giving them the means to do that, not making them have to pay hundreds of dollars an hour for things like that. You generationally heal these large cracks and these large webs of people, just like in a medical case. Yeah.
Thank you for that. Okay. So what we will do is we're gonna move on to the audio only portion, right? Where honest members like you can share their experiences. We would love to hear from you, right? And maybe someone, these individuals like to join us. If not, that's okay. But yeah, we're gonna move on to that portion. And so yeah, so that's coming up next. Thank you. I want to thank every person individually here. Thank you so much, Mike, Disability Justice, for being so kind as to come and share your story. This was amazing. Thank you so much, friend. Mike?
Oh, I didn't know you wanted me to talk.
We can plug yourself. You can plug yourself on anything you're doing now.
Yeah, sorry.
I'm sorry. This is what we usually do at the very end. So, sorry. Yeah. But this is not the end of the stream, so don't go away. Yeah, go ahead.
Yeah.
Okay. Sure. I guess I'll plug the Disability Caucus's website because I've been working on that a little bit. So yeah, I'm Michael Bryan. I'm the chair of the Dfl Disability Caucus in Minnesota. We have our new website, dfldisability.org. We just recently put out a statement on behalf of the caucus as in solidarity with some of the friends and families that were affected by police violence in Minnesota. There's a lot of groups in Minnesota that are advocating for kind of reopening a lot of the cases in Minnesota and having State Attorney General Keith Ellison look into them and reopen them. So we called for that on behalf of disabled people and in solidarity with the people who were affected by this the most. So, and yeah, and we did that on the anniversary of George Floyd's murder. So that's on the website. We put out a public statement, put it out all over. So yeah, if you guys want to see that, or if you want to donate, help out, that'd be awesome. Or maybe actually donate to the donate to the cause. We got ourselves covered in Minnesota. We're good.
So, if you have any links at all that you want people to know, throw them in the Twitch chat. So yeah, don't be shy to do that. Next, Nicole, thank you so much for joining us and sharing your very, very powerful and personal story. Yeah, this is it was quite elucidating, and I know you you put in so much work into this, and I don't know if it is something that is easy for you to do, right? Tell this story again and again, but you were so kind enough to do it for our community. We very much thank you.
Yeah, thank you for having me.
Mm-hmm.
Feel free to follow us at t1international.com. You can also follow us on Twitter at T1International or Insulin for All, or my personal Twitter is nsmithholt12. We appreciate the support. We're gonna make changes in the insulin industry. That's for sure.
Mm-hmm. Okay. Thanks so much.
If she says it, you know it's true.
I believe it. Okay. Yeah. So, yeah. Next, we will go to Empress. Empress, thanks so much for being around, buddy. Again, that was an amazing story that you shared. If you want to have anyone follow you anywhere, please take the time.
Yeah, no, again, I can't thank you enough for having me. This is my lifelong advocacy project. Like I said, this is what got me started in activism in the first place. In fact, I was thinking about it, and I realized the first stream I ever did was not Twitch, was not anywhere else. It was on some random platform with an individual named Martin Shkreli, where I came on and I debated him about his raising of a price of a drug named Daraprim. You guys should know this story. And that was actually how I found Discord. I joined his Discord. He was my first friend on Discord. Obviously, that all got shut down when he got raided by the FBI. But yeah, my name is Empress.fm. You can find me on Twitch and Twitter and whatever other social media I'm on, Reddit, I think, at Empress.fm. You can also check out my website, Empress.fm. However, I want to take a minute to shout out two charities that have been massively influential on me and my family. The first you've probably heard of. It's Ronald McDonald House. Ronald McDonald House provides housing to individuals who are receiving care so that their families can visit them and take care of them while they're in the hospital. I've had friends that have had to rely on this. My family's utilized it when I was in care far from home or even close to home when it just wasn't viable to be driving home so exhausted so late at night. Especially for people who are in long-term care, this can be super useful. Family support is extremely important during those times, both for the individual and the family. So like whether it be, gathering those aluminum tabs, I remember one time we donated a massive amount of them. And they were like, we've never seen this many before. We had them being shipped to us from all over the world. And it was like two long plastic tables full of them. I don't know how much money they actually got from that, but it's something. We also made a lot of monetary donations towards them. And the second one is a charity you probably haven't heard of, and I'll post links to both these in chat, called the Pinwheel Project. Pinwheel Project, their mission is very simple. They give candy to people in hospitals. Once a week during my hospital stay at the first hospital that I was in, they would come around with this little cart, and they would give you you could pick one candy from this giant cart of candy. It was like this adorable cart. And I actually have raised at least $1,000 for them in the past. So if you guys could give her a call, tell her Dylan sent you, she'll know who it is. So yeah, I'll post links to those in chat if you guys want to throw some stuff their way. Again, very close to my heart, and they've had a direct impact on me. So thank you, Prime, for everything.
Thanks so much. Okay, and finally, JohnnyScarlett, a very good friend. Johnny, again, thank you for that story, for sharing your perspective. Yeah, I know this is quite personal, but I think it means so much to the wider discussion. People need to hear these stories, so that minds can change, so they realize how imperative these things are. So thank you so much.
Absolutely. Thank you, Prime. This is something that I've spoken about on Twitch before, but I tend to keep it to an advocacy space because I want this to be a learning opportunity for people. I want, hearing these stories to directly lead to something beneficial. And I appreciate you opening up that platform for us. If you have never seen me before, hello, my name is JohnnyScarlett, and I've been streaming on Twitch since 2018. Currently, I'm an educational streamer. Hashtag educational in the general search bar on Twitch. There's a lot of us. And you can also find me not only at twitch.tv/JohnnyScarlett, but also at these socials and my Patreon, which I am now copying into chat. And yeah, that's about it for me. I very much appreciated hearing everybody tonight.
Same as well. Okay, once again, we're going to move to the other portion of the stream, the M4A Discord server, right? I'm going to go to just chatting just for a second and talk to you guys directly. But then, yes, we'll be moving to that !M4A in the chat, in my Twitch chat. To get to that Discord server, we'd love to see you there to get you plugged in to the large organization. Be a hero. So yeah, okay. So thank you all once again for being so kind as to join us, to spend so much of your time, your valuable time here with us. It's very, very much appreciated. We will continue on. All of you lovely individuals, have a nice day. Thank you for spending your time, your energy, your passion, your knowledge of my community. I know they appreciate just as much as I do. Have a good one. Thank you.